Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillahir Rahmanir Rahim. My name is Shahd Noli, and today my presentation is about an innovative and advanced radiation therapy technique called VMAT. VMAT is an abbreviation for Volumetric Modulated Arc Therapy, also known as Rapid Arc Therapy and Volumetric Arc IMRT. It is considered a fairly new technique because it was first introduced in 2007. It is a unique form of radiation therapy where the radiation is delivered in the form of an arc. Normally, in IMRT, the radiation machine usually stops in between different angles while delivering the radiation, and this is time-consuming because each procedure would most likely take around 15 to 20 minutes to do the entire therapy. But in VMAT, as we are going to see further in my presentation, the planning is done in a manner where the machine doesn't stop, but goes in the form of an arc without stopping in between so that the entire radiation delivery can be done in a short duration. Okay, before getting into details, allow me to first quickly go through the outline of my presentation. First, I'm going to give an introduction. Next, we have the definition of VMAT. Next, we have the process of the technique, clinical uses of VMAT, ProStat plan example. For the ProStat plan example, we are going to see the plan being done using conventional radiation therapy, and then IMRT, and then VMAT so that we can compare the accuracy of the plans. Next, we have a comparison between VMAT and conventional IMRT. Then we have the advantages and disadvantages of VMAT. Finally, a summary and the references. Arc-based radiation therapy is designed to improve the dose distribution through intensity modulation. There are three types of this technique: IMAT, which is intensity modulated arc therapy, tomotherapy, and VMAT. Now, in IMAT, they noticed that treatment time is increased because it requires a large number of beam directions and it increases the monitor units. As for tomotherapy, which is slice-by-slice delivery, it has proven precision in targeting tumors. However, it still requires long treatment time. Elekta and Varian, which are two control system companies, have introduced a new LINAC control system that will be able to change the MLC leafs, which are the multi-leaf collimators, positions, and the dose rate, which is the dose distribution per second, while the gantry is rotating and delivers the radiation in a cone beam. This is known as volumetric modulated arc therapy. So we can say that volumetric modulated arc therapy is an alternative form of IMRT technique that uses the same hardware, which is the LINAC machine, but allows the radiation dose to be delivered continuously in the form of an arc as the treatment machine rotates. Of course, the gantry rotation can be up to 360 degrees. This technique accurately shapes the radiation dose to the tumor, minimizing the dose to the surrounding organs and organs at risk. During VMAT, the following parameters are continuously modulated, which is the gantry rotation and speed, the dose rate, and the MLC speed. Now, the multi-leaf collimators are computer controlled. They modulate the intensity, they contour the radiation beam, and they block out unwanted radiation. In VMAT, each rotation is called an arc. One or more arcs can be used, and that differs from case to case. During each rotation, the cone beam is continuously shaped by the MLCs. The dose and gantry speed are also optimized to generate highly conformal dose distribution, and that is what we want in an optimum plan. The radiation is delivered to the intended area only, meaning that it is sparing the surrounding healthy tissues and organs at risk. Both VMAT and IMRT are effective for normal tissue sparing. However, the treatment time for VMAT is significantly shorter, thus benefits patients who require longer treatment time. As we know, some patients cannot lie down on a couch for 15 to 20 minutes, and so using the VMAT technique, which would only take about 2 to 5 minutes, is fairly more convenient. The VMAT treatment process involves three basic steps: diagnosis, treatment planning, and delivery. In diagnosis, the medical team generates 3D diagnostic images, usually CT, which is computed tomography, or PET, which is positron emission tomography, of the patient's cancerous area, and then uses these images to specify the radiation dose needed to treat the tumor. The physician, this is where our role comes in, designates specific doses of radiation that the tumor and normal surrounding tissues must receive. Next, we have a sophisticated computer program that is used to develop an individualized plan to meet those specifications. This is known as inverse treatment planning. Inverse treatment planning differs from forward treatment planning because in forward treatment planning, the physicist or oncologist would have to conduct the plan from A to Z, whereas in inverse treatment planning, we simply specify the specific doses needed for the tumor and surrounding tissues, and then the sophisticated computer would develop an individualized plan. Finally, we have the delivery. The delivery would only take 2 to 5 minutes in VMAT. VMAT is particularly useful for delivering radiation therapy to tumors near sensitive body organs and can be effective treatment for prostate cancer, head and neck cancer, and lung cancer, as well as a range of other cancerous tumors, but mainly these 3 types of cancer. Here we have a prostate plan example done using the 3D conformal radiation therapy. We can see that there are 4 beams, 2 anterior posterior and 2 lateral beams, and there is a noticeable overdose near the rectum area. The overdose not only affects the organ at risk, which is the rectum and bladder here, it also limits the dose that is being delivered to the tumor volume. Now let's see the same prostate plan example and compare it to a plan done using IMRT, intensity modulated radiation therapy. Now with IMRT, we can see that there are more beam directions, 6 to 8 beams. There is still a risk of overdosage in the bladder or rectum area. So there is not much control in the dose deposition. This is another prostate example done using IMRT. We can see that there are 5 beam directions here. The dose distribution is clearly better than the 3D CRT method. However, there is still high dose in the bladder and rectum area, and as we know in IMRT, the treatment time is fairly long. It is 10 minutes. Finally, we have the prostate example done using the VMAT technology. Over here we have beams coming from 360 directions. The target is highly conformal, and so there is highly conformal dose distribution and a sparing of the surrounding organs, and the treatment time only takes 2 minutes. Here we have a quick comparison between the VMAT technique and the conventional IMRT. We are going to compare between the number of arcs or segments used, the number of monitor units, and the estimated time of delivery. So we can see that for different kinds of organs, the VMAT would only require 1 arc, whereas in IMRT it requires a different number of fields and a different number of segments. As for the number of monitor units, we can see that in VMAT they are all less compared to IMRT, and as for the estimated delivery time, we can see that in IMRT it varies, but overall it is much more longer than the VMAT, which most likely takes 2 minutes. Now, as we know, each treatment technique has its advantages and disadvantages. As for VMAT, its first advantage is that it reduces treatment delivery time because it is 50% faster than IMRT. It improves the accuracy of radiation therapy. It ensures conformal dose distribution. It can spare the normal tissues and organs at risk. It is computer-generated optimization, which is a modern technique. It ensures better workflow, meaning it allows doctors to take more patients on the same machine in a day, and it helps with patient comfort. Because usually when a patient is lying down for a less duration of time, the rest of his body is not exposed to the small scattering radiation, which helps reduce the risk of developing second cancers, which are most likely not noted until 20 to 30 years after radiation exposure. The disadvantages are that the equipment are costly, highly costly. It requires extensive quality assurance of the machines and plans, and special immobilization is required. Now, to quickly summarize and highlight the main points of my presentation, VMAT, volumetric modulated arc therapy, is a rotational approach to IMRT. The linear accelerator rotates around the patient during radiation therapy in an arc shape. Giving the treatment in this way makes it very accurate, shortens the treatment time, and uses a lower overall dose of radiation, which is why VMAT is preferred compared to IMRT. VMAT can provide highly conformal dose distribution and improve the IMRT delivery distribution and efficiency significantly. VMAT is best used for the treatment of prostate, lung, and head and neck cancers. This concludes my presentation for today. Thank you for listening.